I know, we're all having a great time together. I'm glad the chairman walked in. We're going to start our meeting, and we will start with the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. May I have a motion for approval
Romano
of the
adopts the
agenda?
agenda.
Support Van Sickle.
The agenda was moved by Commissioner Romano and supported by Commissioner Van Sickle. Can we vote on that? Can I have a motion for approval of the minutes?
Did it pass?
Motion passes 13-0.
Motion to approve the minutes.
Thank you. Is there discussion? Commissioner Kraft moved for support, and Commissioner Sabatini supported. We'll vote.
Motion passes 13-0.
Thank you. We will now go to public participation. This is for anything on the agenda. Is there anyone to speak? Once? Twice? Thank you. We will now move to presentations. Kevin from Martha T. Berry will start. Can I have a motion to receive and file?
So moved by Matusik moves, support by Nard.
Thank you. Commissioner Matu.
Speak again, you have something to throw at me. With that, I will try and be more clear.
Sometimes they get hungry.
So, yes. So we're going to start a little discussion before we get into the slides with the conversation on the joint operating agreement. Commissioner Sabatini, I owe you an apology because you were here during that time, and I kind of short-armed last time I said the joint operating agreement, or JOA as you'll hear me refer to it, ended in 2010, but what it did is establish a number of things. So you said, we don't have anything to do with that, and I think I heard that and I went, let me clarify that. So what happened is, for those that were not around, the JOA, the Joint Operating Agreement, went from January until 2009 to December 2010. It essentially reinforced Public Act 280 and clarified the roles between the County Board and Macomb County Human Services Board. I'll refer to them as HSB moving forward. So it transferred the operational control from the commissioners to the board, or to the HSB, and transferred bargaining rights and the right to negotiate outside vendors to HSB. The county also said that they would make a motion to move the pension for a separate division for MTB, and for the purposes of that, and I believe this is the critical point that the commissioners were trying to get at, providing a subsidy not to exceed $4 million in 2009 and not to exceed $3 million in 2010. Those were subsidies that were happening somewhat regularly from this commission to Martha T. Berry. And even though, ironically, it doesn't say it anywhere in the JOA, I think the spirit of it is that was it, right? I think that was the spirit of it, is that they said no more money coming from the general fund. Now, it didn't say it in the JOA, but I think that was the intent. And for those that were around, I think from talking to people, they would agree with that. So the county board maintained the right to appoint 2 or 3 members, that's you, of the HSB, to approve capital expenditures for construction or extension of the facility, which we actually did a couple of years ago. You actually own the facility. You own the property and all of the equipment inside. The county owns it, so anything that is purchased there is county property. You maintain the right to sell or close the facility at any time for any reason, subject to any applicable notice requirements under the law and collective bargaining agreements. And I'm going to talk a little bit more about that in the presentation, because I think it's important for people to understand the full You have the full authority there and what it means if you do pull that trigger. So you also have the authority to approve or not to approve any millage used for capital improvements or operations at MTB. The county treasurer is the custodian of the monies, and any interest that is accrued goes to the social welfare fund, which is a separate, discrete fund from county general fund. HSB has general policy-making authority under PA 280. The authority to provide skilled nursing in accordance with state and federal requirements. The responsibility to determine the qualifications of, set salary and benefits for, interview, evaluate, and terminate the administrator. So that's a fun part of that. And if they listened, and I asked them to listen to it last week, I had some comments back on that. So the responsibility to approve all personnel policies, the right and responsibility to set salaries, the responsibility over payroll, accounting, human resources, risk management, benefits administration, legal services, building and grounds management, billing, collection information technology, and other administrative services. And to perform all of the above subject to CBAs. And also it's their responsibility to approve and submit a budget to the county. So the agreement, the termination clause was, the JOA was in effect until midnight on December 31st, 2010. If the agreement was not terminated during its term on January 1, 2011, HSB will remain in operational control of MTB pursuant to the terms of the agreement and Public Act 280. So Martha T. Berry is alive for as long as you want it to be. And if you say it doesn't, you make that vote, and then Martha T. Berry ceases to exist. All right, so in 2013, the commissioners recommitted to the JOA and HSB through Resolution 13-196, where the commission said HSB is best suited to continue to manage and oversee MTB due to the complexity of Medicare and Medicaid regulations. In 2014, HSB filed suit related to these oversight questions, and the judge found for HSB as being the statutorily authorized to operate MTB with the approval of the commissions pursuant to Michigan MCL 400.58 subsection 1. And the judge further declared that the defendant, who at that time was the county exec, cannot exercise control over MTB and declared HSB is the authorized to contract for legal services. The judge also stated that they would not have that, enjoin that forever. So what would happen if you do recognize that if you close MTB, that MTB as a business, essentially, under the Human Services Board would cease to exist, and the building would immediately come under F&O, right? Just sort of aware of how that would function. All right, any questions on that? Is it okay for me to ask for any questions? Because I know there was a lot there. You have to wait till the end.
No, does anyone have a question? I'm sorry, Commissioner.
Thanks. I didn't have it up there, but since you said, do you have questions? And maybe I'm getting ahead. And if I am, just say you'll get to it. But OPEB, if we close it, who's responsible for the debt payment on that?
Yeah, that would be you. Yeah, we will get to that in just a minute.
Excellent. Yeah. Thank you very much.
Yeah.
Thank you,
You get the pleasure of all the debt that we have.
That's what I was wondering.
And I did run some numbers again. We've done this a couple of times. I did it when I first got here. I did it again a couple of years ago when we were talking about all the different ways that can happen. To sell the facility. And some people say, well, you can sell it for its debt, and you can't. You just can't do it. There's too much debt on it right now to be able to sell it and then break even on it. And they said, why can't you do that? And we talked about truth in advertising, overshadowed by a 13-story jail and razor wire with a beautiful view of the morgue across the street from a chemical plant and a five-lane highway. You, too, could live the rest of your life comfortably. But what we are we are the social safety net, especially for other nursing homes. We provide adult day service contracts through Macomb Community Action. We work in conjunction with Ernest's team to provide those services. We provide laundry service at cost to the Juvenile Justice Center. And we provide volunteer opportunities for JJC for those people who earn it. And then we also provide jobs for the Lutz School. Now, when we talk about who MTB is, a lot of people say, it's just another nursing home. Why can't other people take care of it? Well, we are, in my view, we are as critical to the flow of long-term care as a stoplight is at a 4-lane intersection. We are not the popular one, but we help get things done, all right? So as a way of understanding this, you take a look at what our numbers were in 2018 and 19. Our number one referral services were skilled nursing facilities. Because they are private and not-for-profit, they go after Medicare dollars, and when they don't have the ability to pay, the residents don't have the ability to pay, they don't know what else to do with them. They discharge them to us. So we take care of the medically frail and the indigent. There's only 32 of us left in the state. So, and here's the just a quick view of where the impact area was. We have a few people outlined, but the majority of people come from Macomb County. And for those that are wondering, do people from Macomb County get preference? Absolutely. This is a county entity, and if we have a waiting list, anybody from inside the Macomb County is at the top of the list, all right? We're required by law to take anybody from a hospital. So if we have a waiting list and we have somebody coming from a hospital, they have to come from that, but that's required by law. Anybody else on the waiting list, Macomb County residents are first, okay? So let's talk a little bit about the question you had, Commissioner Farrington. So we have currently a pension annual required contribution, because the ARC is performed fairly well, from $0 to $190,000 a year. That's in addition to the money that our staff that have the pension put into it as their co-payment on that. We also have the OPEB bond repayment, which was at the time of this was roughly $1.3 million. When you put that together with the building use repayment, we have legacy expenses of roughly $2.3 million. Now that, in 2018, I shared with the commission that was going to cause a pinch point, and I can talk a little bit about that. At the next time, I can talk about the building use and where the pinch point is there, but I want to get through this so that you guys can get out before the snow hits. Did that answer your question? Okay. In addition, though, we pay our way on everything. We pay utilities. We do food and transportation for the adult day center. We do some of that. We do supplies. We purchase a lot of this F&O repairs and fuel. So we use services inside the county to pay for the building and for the services. The county itself has not paid, since 2010, any out-of-pocket out of its general fund. And a few years back, this commission did allow a 0.1 mil millage one time on a vote of 7-5 to support us to help with some of the cash crunch that we had to pay for expansion of services, which we were regulatorily required to do. Okay, so I have this, this slide here that essentially said that in OPEB in 2015, $20 million in principal and $6 million in interest was put into a bond, so we immediately got $6 million more in debt, which is a debt load of 5% with no corresponding support. And I'm just going to mention this one time. The county finance department thought that it would be good for us to cash smooth by putting the bond in place, because we were going to have a bill of 1.7 at one point up to 1.8 million in 1 year. What they didn't understand is because our reimbursement process is differently, we could have gotten 100% of that back every year for 20 years. But we were only allowed to get to expense the cost of the financing for 3 years. So it was 3 very good years, but now we've got 17 years where we have to manage this. So really quickly, the reality of selling MTB. It has been evaluated, as I said, a few times. So I looked nationally this week at what's happening out across the country, and the beds range mostly between $5,000 and $12,000. 2 locations had $25,000, and in Michigan, the one that I know was the most expensive purchase of beds was at $21,000. So we can assume that anyone, the most you can get if you use the highest number in the nation of $25,000 a bed, you would get about $5.4 million for selling the beds. Our current OPEB debt is roughly $19.4 million, so that would mean that you would be on the hook for the other $14 million immediately, plus any other expenses associated with insuring a vacant building or what you would be doing with that grounds and property, which we're continuing to maintain. Plus, you'd lose a significant number of the wages, not all of them, but you'd lose a lot of people when you close that because they would migrate back to some of the facilities in their own area. Okay. Vaccination status. I'm pleased to say that the numbers have actually changed on this. We were at 87% staff when I did this. We're now at 93%. Staff are either vaccinated or have an exemption. And we're at 92% of our residents having been vaccinated, and we're still at 73% boosted. We're having another booster clinic in 2 weeks. All right, visitation, we opened up, and we actually had over 1,400 visitors over the holiday season, which correlates directly to the 12 residents that we had. One of the biggest challenges we have is people think that when they're vaccinated that they can't carry it. As a matter of fact, they carry it quietly. And they have the right, the residents have the right to see their loved ones' faces. So when they come in the building, they have to wear a mask, but once they get in the rooms, they say, take your mask off, I want to see you. As soon as they do that, they can do that. As a matter of fact, it's in 20.39-NH, which is the QSO memo that said they have the right to do that. So we recognize that we do our best with core infection prevention principles, and we also know that this is an insidious virus that just can quietly go from person to person. By grace, I'm pleased to say that we had no deaths during that time, but we had as many as 12 residents in isolation. One went to the hospital for a few days and came back, and that resident was unvaccinated. The rest of the residents had mild to no symptoms because they were fully vaccinated. Some were boosted. And we had 48 staff up to that during that time that had it during the holiday season. But we're much better now. We've officially have nobody in our isolation area. All of our residents are back to normal. And we have one staff member that's coming back tomorrow from COVID protocols. So again, I want to say thank you to the county commissioners. Over the years, you've been a huge, huge support of Martha T. Berry, recognizing over the years and through all the challenges that it is, in its purest form, a help for those that need it most. And that is my presentation today, Madam Chair.
Thank you, Kevin. I may know exactly where the monetary, where the numbers were. Did you, and I may have missed this, did you say what you pay the county in your presentation? Yes,
roughly for OPEB and pension alone, it's about, and the building use, about $2.3 million.
I mean yearly. Yeah, I mean yearly. Yeah.
It's over $3 million with the purchases that we make, and that doesn't include the repairs that we go directly to the building. So the cash that we give directly to the county for purchase of services, pension, OPEB, and building use is just under $3 million, and then we invest another $600,000 to $1 million a year in the building itself.
Okay, thank you. I don't see any speakers here or any questions. I think you gave a very thorough report.
Thanks for hanging on to the fruit.
Commissioner Song, thank you very much.
Thank you, Chair. So you mentioned that Martha T. Berry provides jobs to the Lutz School. How many jobs are there, or positions?
Well, what happens is we have usually a group of anywhere from 8 to 15 come in and do some volunteer work to help them with transitioning. And then we actually have one active hire and one that came in orientation today with a job coach. So sometimes they work out really well, sometimes they don't. But we want to give them every opportunity to succeed, and our team really are great people to interact with them. So many of the Lutz students that have come through graduated the Lutz program, came to us, they would come for a year or two. One of them had to stop, only because they couldn't find transportation. That was kind of heartbreaking because they loved us and we loved them. But right now we have 2 people that are actually on the payroll with that.
Okay. Now, my next question is regarding the waiting list. What is the capacity of Martha T. Bear? And you might have mentioned this before, so I
Oh,
apologize.
it's a great question. 217 souls we have the opportunity to care for. We're nowhere near a waiting list right now because right now we're at 172.
Okay.
So-
So technically, there wouldn't be anyone on a waiting list, right? Because you haven't hit the capacity.
That's correct.
Okay. But if you were, then that's when the waiting list would kick in.
That's correct.
Okay.
Yes.
Thank you.
And again, by rule, we have to take anybody from a hospital first for discharge, and then the waiting list would be based on demographic.
I was looking at your map and, the various residencies, and I'm very surprised that there are so many different people that come from different locations. My concern will be that, are we really serving our Macomb County senior elderly residents if we have people coming from, all these other places?
That's a
So
great
are we not
question.
reaching out and doing more outreach to our county?
Well, that's a great question. What we're going to be actually working on the next couple of months is marketing, because we've never had to do that before. One of the challenges that we have is because we're really a different model. To try and to market too much, we have to be careful for a couple of reasons. One, we do care for the indigent, right? So we want to make sure that the money doesn't get drawn from services and get too much into marketing. So it's a difficult balance. So we have to look at it more as a PSA rather than marketing. Hey, come look at us. We have to say, look, this is available to you if you have a need. Senior care is so complex. Most people don't understand what it takes to get in and what happens with Medicare and Medicaid. So we do a number of things that I think we could, from a PSA standpoint, let people know, hey, nobody else does this. And that includes, we'll help them with their Medicaid program. We actually pay somebody that used to work in Medicaid to walk through the entire process. So that's a pretty pricey thing, but it's really helpful to people who don't understand, and it is really complex. So that's just one of the things that we do. We'll send social workers out even if they're not coming our way. Yesterday I called Jennifer over at the VA and said, hey, there's somebody from Ann Arbor VA that wants to move over here, and we're coordinating services because he might not get his VA certification for skilled in time. It might take 1 or 2 months. So we have a handshake agreement that if the individual wants to come over to our place, that as soon as she gets it, it'll be in the discharge plan that will move them over to the VA. So
I understand that we don't want to turn anyone away, but what I would really like to see is maybe more targeted efforts to benefit the residents of the county.
well, if you have some ideas, I would love to hear them specifically how that would work. And I'd love to talk with you about it. So,
Absolutely.
yeah, be happy to.
Thank you.
Yeah.
Thank you, Chair.
Thank you, Commissioner. Commissioner Kleinfeld, please.
Two quick things. The first is, if we closed Martha T. Berry, how do you handle the existing patients? What's the process there?
Oh, so it would start with a letter would have to come from the closing agency and the administrator announcing that it would be closed. We have to do that with 90 days prior to actual close. Then we would have to have a relocation plan in place, so we would have to coordinate with the areas and find out what the best fit for them would be. So that's difficult because we're by the same rules required that the for-profits, and the reason they have a 90-day notice is that some nursing homes just one day came and said, we're closing, and just started moving people out with no notice. So they're requiring us to do 90 days, and that's a challenge for anybody. But yeah, we would have to talk about, we would have to actually file a plan with the state and the federal government, with Medicaid, MSA, and then with the feds.
I'm more concerned about if you've got indigent and they're for-profit, what happens to those people, as opposed to that you have to create a plan and all of that.
Well, I can't speak to the quality of what occurs there. I know that it would be a challenge because most of the residents that we have came from those facilities that say they can't qualify. So the biggest challenge would be trying to find a place that would be willing to care for them. And the closest medical care facility that's like us is 70 miles away. There's another one 90, another one 110.
Okay.
So we would probably have to bus them to places that would be, that have the same philosophy and mindset, because most of the facilities really don't want the high acuity, low pay residents that we have.
Okay, so then the second question real quickly is, if we don't intervene, because we voted not to intervene when you came to us requesting another millage.
Yes.
If we do not do that, does there come a point where you have to say to us, you have to close because I can't operate?
No, I'm not even close to that.
Okay.
So what I'm doing is, we are current with all vendors except for the county. And we have a building use that was due in January that we have not paid.
Okay.
So we are kind of cash smoothing in that way. We'll pay as we're able to. I did receive some good news. Our trade associations were negotiating with Governor Whitmer for some sort of relief, and so our rate was calculated in October of last year, and it gave us only a small increase, and she added another 2.5% increase, which is bringing in another $540,000 roughly for us, which is great news. So that's going to help us significantly. That's about 40% of what the building use would be that I did not put in the budget because we just don't have the money to pay for it. But I will stay current on it as much as I'm able to. I'm thinking it might take me 2 years to pay that off. And once that gets paid off, I will be able to start building a sinking fund for the capital improvements.
Okay, thank you. Thank you,
welcome.
Chair.
Thank you, Commissioner. Commissioner Van Sickle?
Thank you, Chair. Good afternoon. The thing that would help me is if you had some kind of a ongoing chart from 2010 or wherever you could show where the debt's going.
Sure. Actually, I can bring audited financial bottom lines, and you'll see where it's at. There was a huge addition to it because the government standards, accounting standards changed, where you had to recognize the OPEB and pension rather than a footnote. It had to be in your financials. So I think that occurred right around 2014, 2015. All of a sudden, it had this big hit. So it might make sense that I start from there, and then you can see moving forward. But if you prefer, I can go back to 2010 and find it.
2015 would be fine. And just off the cuff, is your debt going up or down in 2022?
It'll be going down.
Good.
Yes. We only had the increase in 2021 because they refinanced the bond and put $1.5 million more on it. Again, they didn't understand it because it doesn't hit the county books like it hits us. So I think we had this discussion early on. It was an unintended negative consequence of the county trying to help us out. It saves us cash-wise about $40,000 a year, but it added debt, and it's the only time in my tenure that we went the wrong direction in terms of equity.
Okay, thank you.
Thank you, Commissioner.
Did you predict that? Did you explain that that was going to happen?
I projected our cash issues, yes, but I'd actually asked when they first did the bond to combine the building use and the bond in a new bond and refinance, and they said that they could not do that. I don't know why they couldn't do that, but they did refinance the bond for OPEB only, and I wasn't aware of it until we were having our external audit, and they said, "Why do you have $1.5 million more in debt without a board approval?" And I went, "I have no idea."
Right.
So, and that's when they were comparing. Commissioner, just so you're aware, we have an external audit that one of their controls is they look at what the county sees our books from. So we show them our books, the county sees their books, and we combine to see do they line up, and if they don't, why don't they? And we have to reconcile that during the audit.
Kevin, did you tell me that you pay $500 a year or a year to the county?
No, the $500 is what we pay a gentleman to help with the Medicaid program. So
Okay.
a lot of people come in, they don't understand the requirements, and we pay a gentleman $500, and that is a non-allowable expense that just goes away. But we believe it's the right thing to do to help people when they are poor and they are confused, and they just need help, we do that so that they have the ability, because some of the skilled facilities and some of the assisted living, once the money runs out, they say, I'm sorry, you have to leave, but they don't help them with that transition. Some of them do, but some of them don't, and we want to be there to help.
Thank you very much. I think we will vote on this now. Kevin, thank you for your report. And
Thank you.
Since you thought you were going to have some fruit,
Are you going to do this?
Uh-oh.
oh, nice.
Ah, it's orange juice, thank you.
Sorry. I haven't played baseball lately. I need to play some more baseball.
I like it. Thank you.
Motion passes 13 to 0.
So that means we get to throw one at Ernest as well.
You can do it over him, don't worry, I'll catch it.
I'm not giving mine away.
Does the fruit get bigger?
Depends on the conversation. Thank you.
Ernest, I believe you are up. Oh, no, I'm sorry.
Madam Chair, I'd like to make a motion for receive and file on the Veteran Services fourth quarter report.
Support Van Sickle.
I can't do veterans yet. Laura, we're going to skip veterans for now. Hopefully Laura will make it.
Thank you very much.
Can we
Motion
do- I'm trying to see the
removed.
next one because I can't decide if it's Andrew or I think Andrew's next.
So you get the cantaloupes, I get the water biscuits, right? I'm going next.
Yes, I just didn't see where it starts.
Chair will make a motion for Mortech Manufacturing.
Thank you, Commissioner. Commissioner Song moved for, where are we at here? For D. And Commissioner Wallace supported. Thank you, Andrew, for coming forward for me. What do you want to
Thank
tell
you,
us?
Chair. Thank you, Commissioners. Before you, we're hoping that you approve the equipment that is needed for the medical examiner's office, the expansion project. I spoke about this in December, that I'd be back soon, and here I am to present the winning bid. So this did go out to bid. Mortech was chosen. They were the middle bid because of their quality and their history, and really essentially the tables. What these tables are hydraulic autopsy tables. As you can imagine, bodies are getting bigger and bigger, and we need to make sure that our staff are safe in
safe.
terms of ergonomics and support, and the ability to adjust the hydraulic tables to meet their needs is really important, as well as equip this new expansion with the equipment we need for the carrier tables. So this amount is $94,580. It is being paid with capital improvement outlay dollars from the medical examiner's project, which is $620,000 scheduled to be under budget, which it's going to be closing soon. This is the last piece of that project. So with the budget, because it was under budget, we were able to utilize those funds to also include this equipment that's needed. I'd be happy to answer any questions. Thank you.
Commissioner Song, please.
Thank you, Chair. So a total of 10 standard carrier and then 10 with the tray. So a total of 20
Correct.
for this amount. And does that include delivery and installation?
That does.
Okay, thank you. Thank you, Chair.
Thank you. Commissioner Sabatini.
Thank you, Chair. Hey, Andrew.
Commissioner.
Just when you're looking at this bid tab, it looks like the third bidder, Salem, was about $30,000 less on the base. Just curious why Mortech was selected over them.
So Salem, which it reads Salem, but I think it's Salam actually. It should be S-A-L-A-M. Just it's not the point, but just want to make that correction. When looking at the company, doing our research, they didn't have great feedback and reviews for their site. And the equipment itself is not as tested and tried and true as the Mortech. Mortech is really has the historical background as a company is well run, and so we wanted to make sure that we didn't. We went with a reputable company, and Mortech is definitely more reputable than.
So did they bid with just a totally different item? I mean, isn't this the exact same item that we're bidding out on?
It is not the exact same.
It's not. Okay.
Having conversations with medical examiners, I had that question too, because I'm not an expert in autopsy tables, but apparently there's a big difference in what the bid was for Salam and Mortech.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you, everyone. I think we'll take a vote now, please.
Motion passes 13-0.
Thank you. Thank you, Andrew.
Thank you, Commissioners.
I think he was given a second look for an orange.
Ernest? Can I have a motion to refer to full board?
Motion by
Matusik
Hall.
moves.
Commissioner Hall made the motion. Commissioner Matusik supported. Ernest, yes.
Thank you. For the first item here, this is around the HUD grant for, again, ARP dollars for our home consortium. Similar to the way that we talked last time about the CDBG dollars. Again, this is the county receives it. We are not the decision makers. The municipalities are the decision makers in this. So similar to CDBG, you can contact your local mayors, municipalities, city councils. They are part of the decision-making process. We receive these as a fiduciary. We support the shared decision-making of the municipal governments across the county for these dollars. The one distinction here I want to point out is traditionally we run the home program. You may know about the home program. One of the great benefits of the home program is we can give no-cost loans to homeowners, up to $30,000. We have a lot of seniors that might have bought their home in the 50s. They need some lead remediation. They need asbestos remediation. They need, big rehabilitation projects they can't afford. We're allowed through the home project to give them a loan as a lien on their house, which they can then pay off at the sale of their house. So that's one of the things most people think about when they think about home. These home ARP dollars were they're authorized for more urgent use. For homeless residents, homeless services, one of our main providers here is Turning Point, supports women fleeing domestic violence situations. So again, these will be used not at the discretion of Macomb County, but in partnership with the consortium of municipalities around the county. If you note, this goes till 2030. So this was authorized as ARP dollars to come to Macomb. We have till 2030 to use it. This is not acceptance of a plan. This is acceptance of the funds. We again will come before the Board of Commissioners with the consolidated plan like we've done for CDBG. I remember last time one of the questions was, why am I getting the 2019 plan? We always come to the commission when there's an actual plan or budget amendment, allocation, or distribution plan. So this is just receiving them. There's no plan or contractual obligations here. This is us receiving them. We'll take it to the home consortium of partners around the county, and you'll see this again in the future when they find eligible and reimbursable items that fall under the home grant.
Commissioner Matusik?
Thank you, Madam Chair. Under the funding source, it says Oakland Livingston Human Services Agency in partnership with the Great Lakes Water Authority.
Yes, I apologize for that. That's an error. If you recall, as a pop quiz, this is related to the RAP program. The RAP program was also in partnership with Great Lakes Water Authority. We caught it after it was already published. Sorry for the error.
I was confused by this reference.
Yes, so
Got
was
it.
I.
Thank you. Thank you, Madam Chair.
Thank you, Commissioner. Commissioner Farrington?
Thank you, Madam Chair. Yeah, Commissioner Matusik asked the one question. I was trying to figure out how the Water Authority had something to do with this. a lot of money through ARP has been put into this and similar services, and I understand with the home loan, when the program's over, it doesn't, but some of the other ones are transitional. Do you anticipate problems when all of a sudden the proverbial financial rug is pulled out at the end of these programs? And what will happen to that same community that now came with an expectation?
Sure.
And we set up programs that will no longer be funded?
I think it's a great question. Historically, if you look at the homeless services provided in Macomb County, a lot of them are like McCrest or Turning Point, right? I mean, you have a woman fleeing domestic violence. She's seeking temporary emergency shelter, and we support her through the transition. Of course, we work with Michigan Works. We try to get people back on their feet. You have a very small portion of people that are chronically homeless. This really was in response to the worry that we would see a large surge of evictions and homelessness. I don't necessarily anticipate that. So again, when we came before the board before, if you remember with CDBG, you said, well, wait, why are we reallocating this money? The same as with this $6 million, you'll see what's allocated toward administration. That's because this goes till 2030. If we don't spend it, we always come back and we go to all the municipalities and say, do you have any other eligible purpose for this? We're not deciding to put something forward, it's the municipalities. We're here making sure that they meet all minimum standard requirements, eligible purpose use, and meet the criteria. So I hope that we won't see that surge through 2030. This was more just flexibility given to communities to say, if you're seeing rampant homelessness and evictions that are chronic, we're going to give you the resources to bolster capacity temporarily to serve it. So I don't think this will be an issue where because we scale up capacity, all of a sudden we become a magnet for homeless people from Wayne County or others to come up here and stay here, and then we see increased numbers for decades. Certainly our goal is to make sure that we do homeless prevention first, right? That's our first line of prevention, is make sure they don't get homeless. Second line is make sure they're rapidly rehoused, and we work with them with conditions to stay in the housing. It really is a small number that are chronically homeless, and it's not my anticipation that this would lead to more homeless coming to Macomb County.
Thank you, Commissioner. Commissioner Van Sickle?
Thank you, Chair. Good afternoon.
Good afternoon.
Part of this $6 million is going to be loaned out. Is that what I heard you say?
No, I was trying to make the distinction. Our traditional home program is known for that loan. This ARP dollars do not allow that loan. These are for the other tenant-based rental assistance, emergency shelter and housing prevention.
Okay, so these are expenses.
Yes, this would not be loaned out.
Okay. But you do have other monies loaned out.
Yes.
And they're loaned out, I assume, at a low interest rate?
Yeah.
And you have monies coming back in. As those monies coming back in, do they go into the pool to be loaned out again?
Yeah, there are a lot of restrictions around that. HUD is one of the most fastidious regulatory agencies I know of. And so that's one of the reasons why dollars like this have such a long administrative process. We might get dollars back 15 years after they were originally loaned out. And when we receive those, it has to go through a full HUD audit for eligible reallocation and expense. But yes, that is the goal, that we loan them out and we get them back, and we don't need more from the government because the loan came back. Now, of course, $5,000 in the 90s can't buy what $5,000 can in 2020. So there is some of that, but that is our goal, to loan them out, to get them back. We didn't earn interest on them, but they're ready to go back out and support eligible residents.
Can we get some kind of an accounting as to how much money you actually have loaned out?
Sure. Yeah.
And how much of it is defaulted on?
How much of it's defaulted on? Sure.
Thank you, Chair.
Thank you, Commissioner. Commissioner Ha?
Thank you, Chair. Ernest, switching subjects a little bit.
Yeah.
I thought, based on the conversations you and I have had with the CHORS program, I'm sure I'm not the only commissioner that has gotten phone calls from seniors and veterans saying, we got a big snowstorm coming, how do I get my walk done?
Yeah.
You may want to take the opportunity to explain the difficulty in trying to address that request, and then some thoughts that you and I discussed for the future.
Sure. Would you like me to do that now?
Without objection, Chair,
Please do.
Sure. Well, as you know, we're expecting potentially large snowfall. If the board remembers last year, we had talked about the lawn and snow program. This, of course, it's easier to mow the lawn. The only thing that you don't have to do when you have a dry season is you don't mow it as much. But we mow it every couple weeks. Sometimes we get away for less. With the snow, it's really indeterminate. That was one of the reasons we had a fund balance. If you remember, the last few years, we didn't have a lot of heavy snow. We plow at 2 inches. So if you get 1 inch, we don't dispatch. We save some money, and we're able to serve more people for longer periods. Part of the challenge here is the logistics of the snowplow business. It's seasonal work. Most of the vendors that do lawn and snow scale up in the summer for lawn and landscaping, and they know they don't have as many jobs in the winter, so they scale down for snow. That means when we go and we hear from municipalities, we'd like to put more people on the snow plowing support services for seniors and those disabled. We don't always have eligible vendors that say they can scale up. This isn't a matter of bidding it out. It's really hard to find any person that can get enough capacity in the winter on a moment's notice. The second challenge here is the way that contractual agreements work with many snowplow businesses. If I have a contract with GM, they may say, in the event of continual snow, you must come out every hour and spray a salt solution. Then you must come out every inch and do a full plow. And so if I have that contract with GM, and then I have some contracts with rental apartment complexes, and then I have residential, depending on, did it snow in the middle of the night, I got it all done? Is it snowing all day? How is the snow and sleet looking? Is it a mix of ice? I mean, it's really a chess game for a lot of these snow companies. So oftentimes, if you hear complaints, there is a moving priority list for when our residents get plowed. We enter contracts with reputable, sizable businesses that have the capacity to do this, and they have a moving target on days like tomorrow and the next day. The other thing that you should know about our contract for snow is that we plow when it stops snowing, right? If I know it's going to snow all day, and I hit Commissioner Van Sickle's house at 7 in the morning, let's say I hit it at 6, and then I go on to the next houses, and Commissioner Van Sickle wakes up at 7:30, and he calls me, and he's angry. He says, "You didn't even plow my house." Well, we plowed it at 6, but it's still snowing, and you can't tell. So that's the reason why we plow when it stops snowing, and we plow after 2 inches. So this can create an issue like tomorrow. You may get complaints. If it ends up snowing all day, the houses may not get plowed tomorrow. And again, we give a 24-hour window for us to make it out to all the houses. So it will be a particularly rough time depending on when it snows, how much it snows, and when it stops snowing, and if there's a break in the snow between Wednesday and Thursday. And that's just part of the nature of how we're trying to spread the county dollars as far as possible, as wise as possible, to those most in need, homebound elderly, those disabled, those who are financially unable to pay for somebody. And even if we wanted to, we really can't scale up on a moment's notice. And that's why, again, we receive the dollars and we leave it in control of the municipalities, how much they want to enroll and who they want to enroll, and how much they want to contribute of their municipal allocations to it. So I appreciate you bringing that up. I have had a few calls today for people not on the CHOR program asking if they could get on the list just for tomorrow, which, of course, as you can imagine, is an impossibility. But if we have any suggestions on how we could be more adaptive for these snowfalls, we always want to serve more people. But we are stretching these dollars about as far as possible. If you remember, it's about $500 for a full year of lawn mowing and snow plowing, which I would challenge any of you to find that good of a deal on the commercial market. Yeah, we do a pretty good job. Thank you.
Thank you, Ernest. I have a question on what you're going to do with these houses now that you're going to be working with. How many houses, you talked about refurbishing them, how many do you plan to do at this time?
So I'm afraid I gave a little bit of a red herring here. I was trying to say that this is not for refurbishing. This cannot be used for that. I wanted to point out that normally if you hear about our home program, that's what it is for. But these home ARP dollars explicitly state they're not able to be used for that. These are for more urgent areas of tenant-based rental assistance or homelessness prevention, rapid rehousing, or any of the special populations listed here, individuals fleeing from domestic violence that might not be technically homeless, but would be homeless if they successfully fled the domestic violence situation. So none of these dollars will be used for housing rehab. One of the items later in the agenda, the weatherization deferral will be used for that.
Yes. I thought when I spoke to you, that's what you said it was going to be for. So how many people will be benefiting from this then?
Well, again, there is no plan here for this $6 million. This is just receiving the
All right.
funds. This goes right out to the home consortium.
All right. Thank you. Are we going to take a vote on this at this time then? Or I have no speakers? Thank you.
Motion passes 13-0.
Lost my place. The budget, you want to go through this? You want to go through the weatherization now?
Oh, do I need a motion, or am I good?
Yes.
So
Madam
moved.
Chair, I'd like to make a motion for
Yes.
item F, budget amendment, Macomb County Community Action.
Support Van Sickle.
Commissioner Farrington made the motion, and Van Sickle support. Thank you.
This money is what you'll see it's called is weatherization deferral. We do a large program in weatherization. It's one of the main bipartisan issues at the federal and state level. Everybody loves the idea that we do one-time investments and we have less energy waste, we have less cost for housing, less heating of the outside, and more energy optimization. So we typically do things like insulation in the attic. We do weather stripping in the doors. We do both furnace replacements and air ducts improvements, right? Weatherization to help make, Michigan homes in the winter work better. What we have found over the years is that there are many houses that we say, well, we can't invest insulation in the attic because the roof's going to go. And so that triggers what we call a deferral. And the state categorizes these deferrals. You had an eligible house, they met the eligibility criteria, they needed an eligible service, why didn't you do it? Well, the roof needed to be replaced, so we didn't think we should do the repair. The door was broken, we didn't want to do the weather stripping. And so the state of Michigan has said, we're going to give you a one-time fund, relatively small, $200,000, to address any projects you've deferred. We went to our list, the biggest thing was roof repairs. It's really hard to get money to do roof repairs. So we said, we can repair 25 roofs. We already actually have 12 right now in the queue. And we said if we could get money just for these deferral projects, just to repair the roofs, we can go in and move some of this other federal money into weatherization projects. And so that's pretty straightforward, and that's what this is for. At the state level, they gave us money to address our deferrals and weatherization, and we saw the greatest need was for roof repairs. And so that's what we're dedicating this to.
Motion passes 13-0.
Thank you. Ernest, let me see, moving to full, can I get a motion for moving to full board?
Madam Chair, I'll make the motion to move G and H to full board.
Thank you. The motion is made by Commissioner Hall and supported by Commissioner Romano.
Well, I've been doing a song and dance to buy time for work, so I don't mind if you don't have any more questions. But let me tell you quickly about these. Again, these are pretty small and pretty straightforward. Again, we already provide service under the CSBG grant for emergency utility assistance. The state just ran a formula, gave us an increase, a very small increase, $12,000. Basically, what happens is in some regions, when they don't spend their money, they reallocate it to the state. The state see who has moved the money, who's used all their money. They redistribute it through a formula. We happen to get $12,000 more to help with our utility bill assistance program.
I think we can vote now, please. Thank you very much for your song and dance routine, and very much thank you for coming.
Okay, thank you.
Motion passes 13-0.
Rio, she got away easy today.
Don't worry, they'll be kind. They might throw an orange at you, though. It's happened before.
It was a toss. It was a friendly toss.
Well, he's got an orange. It was on my calendar, and then it was on my calendar for third quarter report, not go-to meeting. and the software, today's the first day we're open, the software's crashing, and
Oh, it's a great
Yeah.
day.
yeah, I have not been at my desk for maybe 10 seconds.
Okay.
And normally my secretary can handle this and remind me all these things, but everybody's preparing to be at home for 3 days, and they have to take all their equipment.
Yes. Well,
So
we're
I know I have
glad
a
you're
lot of
here.
things on the agenda, so shoot first.
We're glad you're here.
Thank you for waiting for me.
I need a
Thanks.
motion to recommend to full board.
Chair, I'll make a motion to just receive and file this quarterly report.
Support.
Support from Kraft.
Commissioner Song made the motion, and Commissioner Kraft support. So, hang on a minute.
Gosh, and everybody's here today.
When you say the report, which are you talking about?
The quarterly report.
Is that,
Yeah, 6B.
thank you. Oh, hang on, I'm in the wrong thing. Oh, here it is. Yes, thank you. All right, can we vote on that? I'm sorry. Thank you. Go right ahead. Go ahead.
Okay, my
Thank you.
quarterly report, which I do not have in front of me, probably looks really, really good.
It's really, really good. This is Ravenna's happiest moment.
Yes. So, of course, I left that on my desk, and I wasn't at my desk when you called to remind me to come. So, as far as the normal quarterly report, probably everything is A-okay.
Good.
I mean, the upcoming agendas and the upcoming stuff, oh, he's going to bring me stuff. Oh,
We've got
he's
it.
so good. Thank you.
Kyle's in trouble.
Yes, thank you. Okay. So I don't think I have a whole lot of concerns. Okay, so at the end of the quarter, which was December, we did get news that we were getting more money, and so that's also on the agenda, so that's another separate item. We also, just to kind of go over, as far as our numbers, we've kept this report pretty much the same way for 8-9 years, since, I don't know, who's been here the longest? Okay, so it's kind of looked the same since Kermit, since I took over from Kermit. So we are rearranging, starting this coming quarter, the first quarter, we're rearranging a few things because it's the data that we're getting from the VA. So what we're doing is we're going to count how many people we help, how many claims we take care of. The difference is folks come in 5, 6, 7 times to work on their claim. So we've been counting those as visits under visitor. So how many claims are we actually doing is still one claim when they come in 6 times. So honestly, I think it might be just easier for my staff, because I can pull a report how many claims I submitted. I can do that. Or we can track how many times people come to us. So it's kind of like they don't jive, basically, because like I said, 6 times for one person to come before we submit a claim for some people. So we're kind of going to look at it a different way based on the information I can track. Okay, so we're going to start that this quarter and see if you like that and if you approve that. The amount, the burial stuff doesn't change. Number of fully developed claims, I can still have that figure. The trust fund, relief fund, assistance, federal back pay, federal reoccurring, which are those dollar figures, we plan on keeping that. The biggest thing is it's very hard for us to number 2 and like number 1, number 2, and number 3. So, because if you look at how many visits versus how many claims, it just looks like we don't do anything. You know what I mean? And we do, because they're coming in a few times. So let's try that for next quarter, and if you like that, we'll keep going. If you want us to revert back to the other way, we'll revert back to the other way. It's just getting harder for us to collect data. So So basically, if you look at number of claims new and ongoing on number 2, we did more than the previous year by a lot, because we're seeing more people come in. As in 2020, we didn't see many people come in, and it was hard, and people honestly didn't even submit claims. So we are now seeing folks coming in more often. And remember, the advertising has helped, because that reminds people to come in. If we look at the federal burial, these are just the, federal burial doesn't have an income limit. So if they're service-connected or disabled, they're going to get a federal burial allowance. It goes to the person who paid it. So it's not income-based or asset-based like our county federal burial allowance is. So, and I'll talk about that when we get to the next agenda item. Do we have any questions about how many burials? Like number 6, since that's going to be on our agenda here in a little bit. If we look at last year, this year we did 188 county burials, and last year we did 83. And people have 2 years to come in, so people are coming in for last year, so we did see a lot. It's almost like I almost needed 3 years because of the pandemic, but does anybody have any questions?
Laura, Commissioner Brown, Chair Brown has a question, please.
Thank you, Laura. We're getting back to your reporting a number of claims. Can you also have unique claims? How many are unique claims that come in the office so we can keep track that as concurrently?
What I do is I use my software and I run a report. And the report will tell me how many times I filled in this form, how many times I filled in these other forms and created those forms. The biggest thing is what are you counting as a claim and what am I counting as a claim? So a claim could be a disability claim, it could be a pension claim. Actually, a claim is also adding dependents.
Let me change that. How about unique visitor, unique person?
We already tracked that.
Yeah.
That's
Yes,
number 1.
alongside. Okay.
Okay, so if they come in 6 times, you want me to count them as 1?
Yeah, because it just shows how many unique people, unique individuals are coming to the office.
Okay.
Whether they got 1 claim or 10 claims. Alongside, I mean, it's just interesting information, right? So we know, how many people are actually coming in the door, and how many, just gives us a sense of how much work one person is for you.
Right. Well, the numbers on number 1 show all of them. So it's not unique. It's if they came 6 times, they're counted 6 times under number 1. So, but it gives us a little bit of the demographics of who coming into our office.
Well, I like the change of the format, freshens it up. It was overdue, so appreciate
It
that.
is.
Thank you.
Well, and plus the VA is changing too, so we need to kind of be able to
How
collect the
dated is the
data.
information you're getting from them?
What's that?
How dated is the information? Is it real time or is it last year's information like the?
Oh, the GDX?
Yeah.
No, I can pull a report and it's
Real
as
time?
of, yeah.
All right, good, thank you.
Yes,
Thank
sir.
you, Madam Chairwoman.
Thank you, Commissioner. Commissioner Romano?
Thank you, Madam Chair. Laura, it wasn't going to be that tough a question. You don't have to leave. Oh,
I just want to write it down, because by the time we get to all the other agenda items,
did I read something that they've increased the burial expense?
that's on the agenda today, sir.
I'm sorry, I can't hear you.
That's on the agenda today.
Okay.
That's on a different item.
Thank you. Done.
Thank you. And Commissioner Matusek?
Thank you, Madam Chair. Hi, Laura. I don't want you to short your report in terms of the actual work you do, that we need both the one person that comes in and their claim is satisfied, but you also should keep track of that person came in 6 times, because that's really the work that you're doing. So I got no problem redoing your form, but I don't want you to short yourself or your staff. So we need both the individual's claim and the number of times, the number of people who are visiting, because I think that indicates the real amount of work you're doing.
And I didn't plan on changing number 1. Number 1 is who walks in our door, who calls.
Okay.
When we take care of them. Because we're still taking care of people over the phone by mailing them documents, emailing them documents, and then they send them back secure with the county's secure email.
Right, so I would think that keeping track actually of all of your contacts,
And we do.
yeah, walking in,
Yep.
email,
And that's number one.
yeah.
That falls under
So
number one.
I wouldn't want you to get rid of that, because I think that indicates the real
Okay.
amount of work that you do. But it would be nice to know how many individual, unique people you deal with. Thank you, Madam Chair.
Thank you, thank you, Commissioner. Commissioner Van Sickle?
Thank you. Good afternoon, Laura. If I'm understanding everything I'm hearing up
Where
here,
is- oh, okay, sorry. Uh-huh.
if I'm understanding everything I'm hearing, you actually have 3 counts. You have the number of people who walk in, the number of customers, if you will, that
Right.
you have. Then a bigger number than that is the number of forms you're filing,
Number of claims.
because some customers have multiple forms.
No, but it's still one claim.
Oh, it's still one claim? Okay, my mistake.
But but understand that it's one claim, but it's also like, look, for example, Don just submitted Commissioner Brown submits a claim, and it gets awarded 2 months later. Well, now I need to add his dependents. So that's another claim for dependency. I don't send it in at the same time, but you know what I mean? If I did send it in at the same time, then that would be one claim.
But that winds up being 2 claims because I had to come back for a second item.
Yes.
Okay.
See where I'm getting confused? I confuse myself. You know, because it's like, okay, do we just count this or do we count that? But, all right, so,
So then every time a person walks in the door, so if they walk in the door 3 months later to do another thing, do they count as another person? Okay. Thank you.
All right, are we going to vote on this now? I'm out.
Motion passes 13 to 0.
thank you. Thank you. I think so.
Oh, I don't know where I am here. I'm out of something. I'm out of everything.
It's going to be these two that I need to put. But this one already, that one's okay. Well, I'm glad we're having the meeting today and not Thursday. Just saying. Or else it might be Zoom, huh?
Good, thank you. All right, can I get a move to full board on,
Madam Chair, I'd like to make a motion on 7A, the budget amendment for veteran services, to recommend to full board.
thank you. Commissioner Farrington moved for 7A. Commissioner Romano, support.
Got it. Oh, the next agenda is the budget amendment for the MVAA grant. So in December, they notified us saying that there was some more money, like, just like Ernest said, that there was some leftovers, and they were going to redistribute $900,000. So when I do the math, 900,000 divided by 83 counties, it's about 10 grand. Okay, we're probably going to get a little bit more than 10 grand, because it's also based on how many veterans you have in your county. I got 123 more thousand. So I'm already ready to spend that once you put that in my budget and approve it. And it's all going to go to advertise. 100,000, over 100,000 is going to advertising. And then we're going to buy more computers for the VITA tax program, because we do help veterans with their tax program. But other than that, it's more for the advertising. So if you can approve it, I can spend it.
Commissioner Kraft, please.
Thank you, Madam Chair. Hi, Laura.
Hi.
Is there a reason why it was signed by the executive's office before it came to us?
The,
Because the
which
deadline isn't until July 31st, so it's not like there was a rush.
no, wrong.
That's what it
not
says
correct.
right here.
Okay.
I'm looking at it in the document.
Okay, so
Amendment
when they
deadline
sent.
is July 31st.
Correct, but when they sent this out, just a few weeks ago, actually like a week ago, they said we had until February 1st, or February 12th for that specific amendment to be approved and sent back to them. So the exec's office always approves our, I guess you want to call it contracts. So every MVA grant, the exec's office is signed. So there's a place for them to sign and me to sign, and then we send it back to MVAA. This process is just a copy, and normally the amendment is supposed to go in, and I think we have until July to do normal amendments, but for this specific drop of new money, they wanted it back by like February 14th, February something. And I can't remember that date off the top of my head, but I just knew it was before your full board. But,
Okay, well,
but it was only this document that had to be back,
sure.
the amendment document.
I would suggest, just as a cleanup, to have Vicky redate it because it says November 25th of 2022. So just make a note of that before you send it in. Thank you, Laura. Thank you,
Okay.
Madam Chair.
Thank you, Commissioner. We will vote on this.
Okay.
Motion passes 13-0.
Thank you. I need a motion.
Madam Chair, I'd
To
like
re-
to make a motion to combine 7B and 7C to refer to the March Government Oversight Committee meeting.
Support.
That is Commissioner Farrington made the motion for B and C with support from Commissioner Hall. This started with Pat Daniels asking me to see if we could increase the burial amount, and then I asked Laura about it. So this, we're going to see if we can pass this to consider an ordinance. We need an ordinance to increase the county burial reimbursement. And then she needs her to increase this $50,000. And then this is going to go to the March Government Oversight Committee. And that's where it will end up. Do you have anything you want to say about that, Laura?
Yes.
Did that cover it, or?
Oversight. Okay. So I've had some chats with other counties that have passed and increased their 300. The state law says we must pay 300, but that's just the minimum, so we can increase it. What we have found, and the folks that are in crisis where they just can't afford a cremation of $800, if we increase it with DHHS's assistance, because they have a set amount that they pay for cremation, if we increase ours to 500, they get that amount from DHHS. There is less than, I'm thinking only like $50 left for the person who's bearing the expense out of their pocket. So a few other counties have already raised it, and it goes through the county commissioners to pass and approve that we raise it from 300 to 500. When I did the statistical data on how many, we get the death certificates from the clerk's office of every veteran that passes away. So based on how many letters we send out and how many people actually come in and qualify, because it's 40,000 assets or below, and it's 40,000, and they had to be wartime to collect that. We're talking 10% or 12% max of who actually are eligible for that burial. So the goal is to increase it to the 500 and also include peacetime. Because 1975 to 1990 is peacetime. And also between World War II and Korea is 5 years of peacetime. And about 6 years of peacetime between Korea and Vietnam. So that would help our constituents. And how much is this going to cost me? I have no idea. Because all I can go off of is the data that we already have. And I'm assuming it's going to probably increase it maybe another 10 or 15%. But we have it in our budget. We can do it.
Thank you, Laura. Commissioner Farrington, please.
Thank you, Madam Chair. Yeah, it's interesting. I appreciate the peacetime. My father, who's long passed, he always kind of had a problem with the whole peacetime wartime because he missed Korea War by 1 week, and yet he was shot at many times over there. But he was not qualified under the war stipulation. Question, so, and you explained it a little bit, I want to understand it. So someone that passes away, they have assets under 40,000 with this ordinance or in peacetime, they qualify. Are you saying the cost to cremate them is only $550?
No, the cost to cremate, right now, I think it's Generations Cremations is $795 or $895.
So who handles, if we raise this to 500, who handles the other $295 plus it'll go up every year from there?
DHHS.
So they'll take care of it,
Within about $50.
Okay, because the first thing I had, and I know I spoke to a few others when I read this, is why is it not higher than 500? But it's being taken care of for these families that sacrificed everything?
Now, remember, if they're service-connected disabled, the VA gives a federal burial allowance.
Okay.
It's $300 towards the funeral and $700 and some change towards the plot if they're buried. But as I say this kindly, totally kindly, if somebody is low income and can't afford all of this, the least expensive way is a cremation, and then they bring the urn home. And they pick out the urn, and an urn can be anywhere from, gosh knows, I've never picked out one, so I know there's obviously different prices in it. So I just know the actual cremation's around $800, and then the urn cost is added to that. So, I mean, there's a good chance they can get the $300 from the VA if they receive a check, if they're receiving pension or disability from the VA, and it's not service connected, they're still going to get that extra $300 from the VA.
So someone that's under $40,000 has no children, they'll be taken care of.
There's a different stipulation for that. If somebody has no, they call it an unclaimed remain. If there is an unclaimed remain, and to claim a remain, you have to be a relative. So when we had a veteran die who had no family, he was actually the chair of the Homeless Coalition at the time. I'm the one that found him because he missed a meeting, and I went to go look for him, and he had passed in his apartment in the low-income apartments right here. So he actually sat at the morgue for 30 days because he was unclaimed. The VA changed the law about 2015 that if it's an unclaimed remain of a veteran, the VA covers the cost for the casket, the transportation, and everything.
Okay. Thank you very much. Thank you, Madam Chair.
Whether they're service-connected or not. So.
Thank you, Commissioner. Commissioner Saw.
Thank you, Chair. I'm not sure if this question is for you, Laura. I'm just trying to understand that if we do pass this ordinance, looking at page 7, it says the effective date to start is January 3rd, 2022, so, which is already passed. So would this ordinance be retroactive, or would it just be from the day that we adopt it?
We are not passing the ordinance. We're giving this to government.
I'm saying hypothetically because...
Right. It's going to now go to March
Right.
before
But
the
on this
earliest it would be
document
approved.
here, it says effective date to start January 3rd. So is the plan to make this retroactive to January 3rd, or?
No. We started this back in, I believe, October, this process to bring to you. So the goal, the objective is to start the day that it is approved. Once it's approved, we can then change our documents to show 500 and then from that day forward. And we do have people waiting to be reimbursed or waiting to submit their claim because this is pending right now.
So when they submit their when you say they submit their claim, like they've already went through the process and they're
No.
submitting it to do reimbursement, or?
But they have 2 years to be reimbursed. So if the veteran passed away, and remember, we also pay when the widow of a veteran passes away. So if the veteran or the widow passes away, last year, and they're very low income, can't afford it, if they just wait.
So it doesn't matter the date of the death, it's just based on the date of the claim?
The date of the claim that they come to our office to collect them.
Thank you.
Collect the check.
Thank you for the clarification. Thank you, Chair.
Thank you, Commissioner. We can vote, please?
Motion passes 13-0.
Must be the orange juice.
What do you, did everybody have oranges today?
No. Well, I gave mine. I need a refer to full board on,
I think we voted
No,
on
we're done.
both items already.
yes. Item D is done.
I'd like to make a motion to recommend full board item, to receive and file correspondence 8A, whatever veteran should know newsletter.
Support, Song.
Do you want to still continue those or keep receiving those? What every veteran should know? Is that helpful?
I like them.
Okay.
Shall we vote on that? Or did you want to talk about that, Laura?
The what every no, it's just an
yeah.
update monthly that we
Okay.
receive from the people who
Yeah.
produce our books and the law books.
All right, we will vote on this, please.
Motion passes 13-0.
All right, thank you, Laura.
Thank you.
Thank you for coming.
Let's just hope that it's a better day than today. Yeah, thank you for
Toss
that.
oranges.
Thank you.
We're glad you're here.
Thanks. Thanks for waiting. I appreciate it. Because it's just that chaotic day that, you think you have your calendar in your brain and then you don't.
It's okay. Everything is
So
fine.
I appreciate it. Thanks.
They're fine. We are now going into public participation. Once, twice, nobody here. Thank you very much. Commissioner comments, please. Oh, Commissioner Matusek.
I just wanted to wish everybody a happy Lunar New Year. A couple of people asked why I was celebrating Chinese New Year. It's because my daughter is ethnically Chinese, adopted when she was 14 months old. Chinese New Year is a part of our family. So wishing you prosperity and good health for the coming year.
Thank you, Commissioner. Commissioner Song.
Thank you, Chair. I also want to wish everyone a happy Lunar New Year today. In addition to it being the Chinese New Year, which falls on the first day of the lunar calendar, there are other Asian countries that celebrate it as well. It's also the Vietnamese New Year. And so I wish all of you guys a prosperous New Year and good health. And it's the year of the tiger. So for those of you that do celebrate it, it signifies strength and energy. Thank you, Chair.
Well, I think we're Macomb strong, so I think that's good. Commissioner Kleinfeld.
Well, after what I learned in that report, I don't know if I'll be claiming my husband my workout better if I don't.
Oh, no, poor guy.
Commissioners, every year around this time, and I forgot about it in January, but every year around this time, we have to give our sergeant at arms some money for the year to be able to deal with all the duties we expect of them. So I'm the first here. I've brought, we had established it the $100. I've brought it, and I will tell you she's had some expenses recently because of some folks passing that have put a dent in things, so I just wanted to remind everybody it's that time of year. That's all I have.
Chinese money, you can't bring that in.
That's all I have. Thank you.
I will say that I had talked to the chair about it, and we thought we'd see how long we could go, but I'm going to have to make a request for people to bring me, show me the money. So I have to ask the chair, I guess we're going to go with the $100. So ante up as soon as you can, because this time I'm going to have to put a tracker dog on you or something. All right, thank you. And thank you, Commissioner Kleinfeld, for waving that money around. You get a gold star. I'm going to find a gold star.
I was actually instructed to do that.
I did tell her that she had it. I said, "Wait, Commissioner Wallace, please."
Thank you, Chair. Happy New Year. Thank you, Julie, for the orange. I just wanted to thank the staff for my birthday card. That was so nice. I really appreciate it, so thank you guys. That's it.
23 today.
Well, your birthday's today?
No, it was January 10th.
Good for you.
But then I got sick and...
I know, we missed you. Commissioner Brown, please.
Thank you. Thank you, Commissioner Matuzik, for the tangerine. I will eat it momentarily. Thank you very much.
Somebody ate it during the meeting because I could smell it over there.
Harold switch with you, Brown.
There you go.
Harold switch with you. No.
That's great. Thanks a lot. And as you all probably are aware, we moved those meetings to Tuesday, so everyone be safe out there and stay tuned and take care. We'll try to get updates from emergency management to us, what's going on around the county. And sometimes when these things happen, I've often found that a lot of things going on in the county regarding emergencies, weather emergencies and otherwise, that we don't have good information on. So I'm reaching out to emergency services to just keep us in the loop as they see fit. So be advised. Thank you.
Thank you. Commissioner Farrington.
Thank you, Madam Chair. Just quick thank you for the orange. I'm glad you didn't bring the tiger in.
Next item, motion to adjourn.
Support.
Did you, I support, yes. Thank you, everyone. We may need to vote before you adjourn. Thank you all.
Stay safe tomorrow, everybody.
Motion passes 13 to 0.